Hi everyone, I want to take a moment and just talk very briefly about treatment of breast cancer. Basically, for most breast cancers, it will come down to lumpectomy versus a mastectomy. And if the breast cancer is small, which fortunately many breast cancers are nowadays, a lumpectomy may accomplish removal of the breast cancer with good margins, but that treatment always comes with some adjunct treatment, some add-on treatment. So if you have a small breast cancer and the doctor says we want to do breast conservation, that means basically just taking out the lump and some surrounding breast tissue and then doing some additional treatment. Typically that's radiation and sometimes some form of chemotherapy as well. So although the breast itself is conserved, so to speak, the breast may be disfigured from the lumpectomy, depending on how big the breast is and how much tissue is taken out. There can be some serious contour deformity of the breast that's permanent, and the radiation doesn't help any. The radiation causes a fibrosis, which basically gets worse over the years, not better. So then you also have to worry about the additional breast tissue which has been left, which has already formed one breast cancer and is at risk of forming additional breast cancer over the course of a woman's lifetime. The alternative is a mastectomy, which sounds very daunting, but basically it can be accomplished by simply removing the breast tissue inside the skin envelope, leaving the skin intact, and then replacing that volume with an implant or with fat grafting or with a flap transferred, for example, from the tummy or transferred from the buttock. So those operations get rid of the entire volume of the breast tissue within the breast, but preserve the skin, including the nipple, and are done through an incision that is usually underneath the fold of the breast where it hides inconspicuously. A woman with a large breast can have a breast reduction type of operation, which removes all the breast tissue and then repositions the nipple and makes the skin envelope more perky before the volume is filled in with an implant. So a mastectomy doesn't have to be disfiguring the way it was in times gone by, which means a ugly scar across the chest. The nipple and all the extra skin is taken and the woman is left with a really horrible deformity. And even with reconstruction, the appearance is not natural and is not very attractive. So a woman can consider a mastectomy and have a very natural, cosmetically natural appearing breast. It's important to know that not every woman is a good candidate for that, but most women are, despite how large or small the breast is, if the breast cancer doesn't involve the skin itself, which most breast cancers early on do not. It's also important to know that any mastectomy, whether it's an old style modified radical mastectomy, which is the kind that leaves the oblique scar across the chest, or the newfangled, cosmetically more desirable oncoplastic surgery and nipple sparing, for example, all of these operations leave some minute amount of breast tissue, somewhere in the neighborhood of 2, 3, 4%, something like that, of the breast tissue, because you can't get all the breast tissue no matter what. So there's no purity to this in the sense that you're eradicating all breast tissue. That just doesn't happen. What's happening is you're removing the vast majority of the breast tissue. And in practice, that's what is good enough for almost everybody. If there's a recurrence of breast cancer, it's highly unlikely to be in that little bit of breast tissue that's under the nipple areola complex. And we have good evidence now from big studies that show the recurrence risk of a breast cancer is the same whether the mastectomy was done with a more modern nipple sparing technique or a more old-fashioned modified radical mastectomy. So there you have it, the kind of the pros and cons of doing lumpectomy with some adjunct chemotherapy and radiation versus a mastectomy, which usually does not require adjunct radiation or chemotherapy for most women. It's also important to point out that most of the time, both of these options are going to include sampling the lymph node on the same side as the breast cancer, and that sampling is called a sentinel node biopsy. Basically, the doctor will inject a little bit of dye near where the breast cancer is, and then go to the lymph node that dye appears in initially, figuring that if any of the lymph nodes under the arm are going to be positive for breast cancer, it's going to be the one that is closest. So that's called a sentinel node biopsy. And usually that's going to be recommended whether you have a lumpectomy and radiation, a so-called breast conservation approach, or a modified radical mastectomy, or a more modern oncoplastic nipple-sparing type mastectomy. So hope that helps. Hope it clarifies things for you and doesn't make it more confusing. You can go to the nonprofit website Breast Preservation Foundation for more details, and there are some videos that may explain things better just watching the video. Be careful, there's some more graphic videos, so if you don't like surgery, probably don't click on those. And you can always email us, and we'll do our best to point you in the right direction. So hope that helps. And more later, direct from Aronowitzland.